Hello, everyone, and welcome. I'm Sharon Davenport, the founding ED of AWN. We are the Autistic Women and Nonbinary Network. I wanted to start today's webinar by saying thank you to everyone who's joining us today, and especially to our panelists for taking time to have already reviewed the resource and prepared to share their thoughts with everyone today. The resource is titled Before You Go, Know Your Rights and What to Expect at the Doctor and in the Hospital. It's a guide that basically has tips and advice, life hacks for autistic trans people about finding and going to doctors. I want to send a shout out and thank you to Victoria for hosting today's webinar, and most especially for all the work you did, Victoria, on co-authoring the guide along with myself and Lydia Brown. Thank you to Lydia for all your work on the project and for organizing the webinar today. I especially want to say how much AWN has appreciated partnering with the National LGBTQ Task Force. We're really excited about the rollout for our organizations to offer this to our autistic trans community. We know how helpful it's going to be. We've had a lot of input and guidance along the way, so we really appreciate that. And I don't want to miss out saying thank you to Erin Casey. Erin is AWN's art director, and Erin is the one who actually did all the illustrations and designed this guide. And I don't want to say too much about the guide itself because that's what the panelists are here to do today. So I'll let all of you take it from here. Thanks so much, everyone.
Hello, everyone. I'm Victoria Rodríguez-Roldán. Welcome to today. Thank you, Sharon, for your comments. And I am personally, my day job, I'm the director, I'm the senior policy manager at AIDS United. I used to be a senior policy counsel at the National LGBTQ Task Force when we started writing this. And I am one of the co-authors of the Before You Go guide alongside Lydia. So it's been a really interesting journey. And with that, I will introduce our panelists. First off is Kayley Whalen. Thank you, Kayley, for coming. Kayley Whalen is an independent communications consultant who works with organizations dedicated to social justice. She has led digital campaigns for numerous organizations, including Sins Invalid, the Alliance for Citizen-Directed Support, the Trans United Fund, Greenpeace USA, Casa Ruby, and the National LGBTQ Task Force. She is a neurodivergent, transgender, Latinx advocate and writer, and was Miss USA in the 2020 Miss International Queen Transgender pageant in Thailand. Her blog, TransWorldView, records her experiences interviewing members of the trans community in Southeast Asia and around the world. There's also Finn Gardiner, who I have had the opportunity to know for a very, very long time, longer than I care to admit, as it's almost admitting my age. Finn is the Lurie Institute's communication specialist. He is a disability rights advocate who is primarily interested in accessible communications, intersectional disability justice, inclusive technology, and equitable access to community resources, including education, employment, and healthcare. Throughout his work, Finn combines disability advocacy, policy analysis and research, and written and visual communications to policy briefs, original reports and white papers, and contributions to research projects. His research and advocacy interests include education and employment for autistic adults, comparative disability policy, inclusive technology, LGBTQ cultural competency, and policy that takes into account the intersections between disability, race, LGBTQ identities, class, and other experiences. He holds a Master's of Public Policy degree from the Heller School and a bachelor's degree in sociology from Tufts University. Finn also serves as a member of the board of directors at the Human Services Research Institute, a nonprofit dedicated to research and policy advocacy benefiting people with disabilities and seniors. Then finally, but not least, we have Noor Pervez, who is a community organizer who works at the intersection of race, religion, LGBT issues, and disability. He is a community engagement coordinator at the Autistic Self-advocacy Network and access director at Masjid Al Rabia. He previously led his campus LGBT plus advocacy group, Rainbow Guard, and gave a number of talks regarding intersectionality. His previous work centered on exploring the intersections of disability, LGBT plus, and religious issues. He is a graduate of the University of Texas at Dallas, the same alma mater of my wife, with a degree in emerging media and communications. So with that, is everyone ready? Is everyone in here? Feel free to put your cameras on if you're there. If you're not, that's okay. So I guess a few questions that I would have is, what issues, for whoever wants to go first, since the topic is healthcare, going to the doctor's office, etc., what issues do you feel trans and autistic people face in accessing healthcare?
I think that there are several barriers, including communication. So a lot of autistic folks may struggle to communicate in ways that neurotypical people may understand easily. For example, a lot of autistic people might be nonverbal. They may use augmentative or assistive communication, or AAC. So they might use like an iPad that is programmed with phrases that they can that the iPad will read out as they press a button, or they'll use a text-to-speech device that they can use to talk. And if a doctor or another clinician is not familiar with AAC, they may not know what's going on when somebody comes in with an iPad or a phone or some other device that they use to communicate. Some other autistic people may struggle to talk about their feelings, or may perceive pain differently from non-autistic people, and it might be important for clinicians to ask further questions to understand exactly how they're feeling. And then trans people also encounter barriers when accessing healthcare. For example, some insurance companies may not be able to reflect a trans person's gender identity on their paperwork, and so if a provider's office isn't set up to acknowledge trans people's identities, there runs a risk that the trans person in question might be misgendered or otherwise treated the wrong way, because there is no method for them to indicate how they'd like to be addressed before the appointment starts. Now, some clinics, especially LGBTQ friendly ones, will have a space for pronouns and names, but that's not the case for all clinicians. It's not the case for all offices. And so a lot of these problems arise through ignorance. And I don't mean ignorance in a condemnatory sense. I mean ignorance in the sense that they just don't know better. They don't have the training, they don't have the experience, and they did not cover these issues in medical school or nursing school or wherever they studied. So you have these systems in place that are designed for an ideal default person who doesn't actually exist. And trans people and autistic people encounter barriers in accessing these services because it's not set up for us. It's set up for other people. It's set up for cis people, that is, people who are not trans, and it's set up for non-autistic people. Another difficulty that arises is, at least for autistic people, might be sensory issues. That fluorescent lights might be too intense. There might be too many stimuli in one place. That's especially the case in a large hospital where you have staff going back and forth, you have patients going back and forth. It's chaotic. And that sensory overload can exacerbate the stress that an autistic person already feels when they're going to the doctor's office. And then if they're also trans on top of that, you're combining the sensory overload with a potential ignorance of how to handle trans identity and possible communication issues, sorry. So all these difficulties combined, it's, you're going to get a tempest in a teapot. It's going to be difficult to get the care you need if there are all these potential microaggressions, if there are all these potential sources of sensory or emotional overload. I know I feel stressed out every time I go to the doctor's office because I'm always worried that somebody's going to screw something up, because I've had so many people screw things up, or people are going to focus on the wrong things. And I think that if you throw race in there as well, then that makes things even more complicated, because people of color, regardless of gender identity or neurotype, are likely to be discriminated against at doctors' offices. A lot of times people of color, especially Black people, will be perceived as feeling pain less strongly than white people. There'll be a lot of assumptions made about our health and what we do. There'll be a lot of victim blaming. Some providers will zero in on, say, weight as opposed to overall health. And there's some there's some racist history behind weight stigma as well, but I'm not going to go into that right now. But there are so many different ways in which a multiply marginalized person can feel that oppression, can feel that marginalization in the doctor's office.
I definitely agree with Finn in that a lot of structures of oppression get kind of baked in to the way that hospitals and major medical systems work. I would say that can surface in terms of microaggressions. That can also surface in terms of a complete inability to understand how trans people might be medically different. So for example, if you have a trans person who has gone through hormone replacement therapy, if your doctor perceives you as, say, the gender you were assigned at birth, they might be missing out on key risk factors that can change when you're changing hormonally. For example, if someone has been on testosterone for several years, they might have an increased risk of certain types of cancers or certain other types of liver conditions. But doctors who have no experience with patients who have been on hormone replacement therapy might have no frame of reference for that, or might be working from the assumption that someone on testosterone is, quote unquote, just the gender that they were assigned at birth. And that can be extremely, extremely dangerous, particularly when you take into account the fact that people who are autistic will frequently have co-occurring medical conditions. So there's that level of things. I would also say that autistic and trans people face a lot of barriers to accessing healthcare that is related to gender identity. Very frequently, I have run into providers that have asked, isn't an autistic trans person just experiencing a special interest in gender, which is ignorance on many levels, but is also kind of a way of coming to a head this system of oppression of ableism and transphobia kind of coming together to assume that autistic people can't have agency over their own gender identity. And it is a challenge when you're in a patient position to advocate for yourself while simultaneously getting the care that you need, because it's very overwhelming, it can be exhausting, and it can put you in a position where you feel like there's no point almost, or like there's just so much going on, and it can make people feel like giving up. And that's where you get people who refuse to seek medical care, or people who choose to not seek treatment for certain types of medical conditions, because these types of situations where doctors flat out refuse to acknowledge their own shortcomings in knowledge, or that are struggling to or when doctors are refusing to kind of bridge those gaps in knowledge for themselves, patients can feel as though they have to do these things for themselves. And it can make it very challenging to feel that you're deserving of healthcare, and it can make it very challenging to feel that if you seek healthcare, that you'll end up better off than you were before?
So I think healthcare access is a huge issue. Even getting a competent provider that's covered by your insurance can be quite a long search. And I found it hard to get a therapist who kind of fully understands both the trans part and what I would say is my neurodivergent identity. So bipolar, ADHD, some combination of autism spectrum disorder that I still is a puzzle to kind of figure out to me. But, you know, I had my therapist who I've been seeing for years as I'm learning more about autistic identity, being like, you're not autistic. I've known you 7 years. You have tons of empathy. I don't think so, you know. You can believe that, but I don't think so. And I think even though he's a wonderfully well-meaning gay man who I trust and has been very accepting and positive, just not having that level of awareness, maybe of how autism exhibits differently in femme and women, as opposed to the stereotypical cis male, or at least male masculine model of autism. And I've also had issues with just educating providers about my transgender identity and health needs, especially because it's non-traditional, because as a queer woman, I think a lot of trans health providers are less aware of the difference between gender identity and sexual orientation, that you can be attracted to women and identify as a woman. Seems pretty straightforward, but I think it's still a concept a lot of trans providers are getting their head around. And one other thing is when we talk about hormone replacement therapy, I mean, everyone has different hormone levels. And when you think about hormone replacement therapy for women, most people just assume it's maybe progesterone or estrogen, maybe testosterone blockers if you've not had a form of gender confirming surgery that reduces your testosterone levels significantly. And then as someone who's had gender confirming surgery that dropped my testosterone levels to below what a cisgender female would usually experience, I had to spend months educating my doctor and asking them to be like, look, I don't feel like myself because my testosterone levels are way too low. And I think some trans women don't pay attention to that or don't care. They have this kind of ick factor. I don't want any testosterone at all. But if you look at normal variation within cisgender women, a lot of cisgender women have, you know, pretty moderately high testosterone levels normally. And I just felt more at peace with myself when I had more testosterone in my system. So this may be true for a non-binary person or a femme trans woman like myself, but even though I go to an LGBT healthcare clinic, Whitman Walker Health, even though I've been seeing their transgender specialist, it took a lot of education to be like, you know, I actually want to take testosterone as well as estrogen. And that was a tough process. So, you know, there has to be a lot of self-advocacy. And unfortunately, we're constantly in a position of having to educate people about what neurodivergent means, about what transgender means, about what autism means, and how, you know, there's the common phrase that if you've met one autistic person, you've met one autistic person. We all have unique needs. And I'd say the same thing about trans people. You meet one trans person, they're not representative of the entire trans community.
Thank you, Kayley. And I would add, I mean, my personal experience as trans, like for example, one time I had to have emergency surgery while in Texas, And Kayley probably remembers the Great Texas Gallbladder Affair, as I called it, and having to take care of my cat during the meantime. I remember very distinctly, like in the prep for the surgery where they're gonna slice me open and extract an internal organ from me. One of the nurses asked me, "Are you pregnant?" Now wanting to do a massive education of what is trans, I say no. She asked, "When did you last have your period?" Okay, it's inevitable. I'm trans. And she just says, "Oh, okay, but what does that have to do with anything?" And at that point, I was pretty much like, okay, just put me under. Like, I don't want to have this conversation. Just put me under and slice my belly open. But that is an example where even the well-meaning, the not being transphobic, etc., can come with transphobia, with misunderstanding, and a large amount of trans people do avoid seeking medical care precisely because they feel unsafe in seeking care. Which brings me, let's see the questions that we have prepared. In the sense when you go give advice, because the guide we're announcing is precisely about advice for autistic people around how to access healthcare. What would you think is most important for trans and autistic people to know about accessing healthcare? Like, basically, I'm thinking if you had to give advice to someone who was somehow born yesterday and has never accessed healthcare, has never gone to the doctor ever, but yeah.
So in terms of what would be really important to talk to trans and autistic people about in terms of accessing healthcare, I would say before anything else, to know that there is community. There are people that have gone through it before, and that while it can be a challenge to connect with those people, that it's really important, if it's even remotely possible for you, to connect with a larger community and to get an idea of some of the challenges and some of the problems that we face in healthcare, and to get an idea of the different ways and different approaches that people have taken to this historically. I would definitely say that learning how to be your own advocate in terms of understanding your rights in a medical setting, and this can vary by state because unfortunately, particularly in the US, anti-discrimination laws around transgender identity tend to vary depending on where you are. But know what the rules are in terms of what providers have to do where you are, and understand what rights you have in terms of as a person with a disability, in terms of what anti-discrimination protections there are for you, as well as what kind of the standard issue problems are that you're going to run into for your particular condition. For example, as someone who uses a power chair, I will very frequently run into hospitals that are inaccessible or that have treatment rooms that don't have enough room for me. So I've gotten used to that idea. And for me, what ended up working was getting a travel chair, which it was obtained for other purposes, but has ended up being useful for medical settings because it's smaller and can fit into smaller rooms. That's one example of an accommodation. It's a very literal one, but other examples might be talking about if you have, say, a sensory reaction to certain types of products. Like, I know, for example, that there are people who have either allergic reactions or sensory reactions to latex. It might make sense to advocate for yourself and to say, hey, latex causes negative reactions for me. Can you please use a different type of glove? Or if you are really proactive, you can bring a box of gloves yourself. But things like that, in terms of understanding kind of what you are going to be up against and understanding the different tactics and different approaches you can take, you shouldn't have to argue constantly to get what you need in a medical setting. Unfortunately, in a lot of cases, you're going to have to, and that sucks. I would also say that in non-COVID times, when it's a lot easier to bring an advocate with you. So for example, a partner, a family member, a friend, or a direct supporter, that can make a big difference in terms of having someone to help you if you're overstimulated or if you're having communication difficulties that you don't understand how to solve in the moment. There are procedures during COVID for people to bring support people in with them to the hospital if you have a disability. However, people run into a lot of difficulty with that, unfortunately, with providers who either don't know about the fact that that's legally allowed or flat out refuse to deal with the legislation, which is a whole nother can of worms to deal with from a legal perspective. So basically what I would say, just to kind of boil it down, learn how to self-advocate, learn different approaches to self-advocacy, and learn about your rights and your ability to bring in direct support people.
So Finn or Kayley, what do you think is the most important thing or advice or whatnot that you would give to people, trans and autistic people who are seeking medical care? Is the most important thing they need to know?
Okay, there I am. Okay, I think that it's important to be straightforward with trans and autistic people. Let them know that there are issues with the system and that they may need to fight, but they may need to be prepared before they go to the doctor. For example, they could have a list of all their needs and like access needs, information about their condition, information about their gender identity, etc. You could just condense that all into a list and give it to your provider, or even keep it for yourself so you have a script of what to say when you go to the doctor. While I haven't used a script like this in a while, I have created similar documents before. So I remember, oh, if somebody says something asinine about my gender, then this is how I react. And I think it's also important to know where you can complain, where you can report issues, whether that's to somebody at the hospital, like a director or a manager, or your state's or a committee in your state that oversees healthcare. Just knowing where to report is helpful. So if something really bad happens, you should know where to take the complaint. I also think that, I agree with what Noor said about bringing someone else along if needed. I've never done that myself, but I know other people who have. I also think that having a self-care routine both before and after the appointment can also help. Maybe making sure that you're not doing other things that day if it's possible. Now, if you have to work, you have to work. But if you don't have to work, if you don't have to do other things, then just take the time off. Take time off after the appointment so you can decompress.
So I find difficulty going to a doctor, and unfortunately, as someone with a marginalized identity, we can get really angry and get really pissed off that we feel like someone doesn't understand our needs. And that's great as an activist and to have someone in your community you can talk to about that, but it's not going to get you very far with healthcare. I remember getting so frustrated that one day I was in line at the LGBT health clinic, and I've been fighting so long to get my hormones, and they didn't have them that day after such a long fight. And I just was so mad. I threw my smartphone and it smashed. And I think that's because we talk about spoon theory or running out of the ability to cope and deal with stressors and microaggressions that add up and up and up. I think it's good to have a person there with you to help calm you or be on the phone with someone because it's a very stressful experience. Um, and just knowing your limits, I think it's great. You can take time off and then focus on going to the doctor. Unfortunately, that's not true for a lot of us. But just knowing what you need to get, treating it unfortunately as transactional and an emotional plea won't often get you as far as just coming there with data and facts and concrete needs. So
Thank you, Kayley. I would also add that when it comes to what should people know and understand, I always try to say that we need to have a mindset of the doctor works at your pleasure, basically. Like, they work for you. Like, if you had a car and you don't like the mechanic or they did a shitty job of repairing your car, you wouldn't come back there. You would change them. It is more difficult with doctors, and at times they have a lot of power over you, especially when you're inpatient in a hospital or when you have crappy coverage from your insurance. But at the same time, you should try to see the doctor as not some know-it-all, but as your own life experience, and they're there to work for you, basically. And in that sense, you should always try to have that attitude towards it. But yeah, with that, I think one of our last questions is basically, what can policymakers do to change circumstances for trans and autistic people accessing healthcare? And what do you think about that? As far as how would you go about doing that? I'm sorry. As far as what should be, I'm a policy attorney, basically. What would you suggest for as policy solution to fix this, to make healthcare more accessible for trans and autistic people, to make them less afraid of the doctor? And I myself can come up with a few, as we're litigating right now the discriminatory regulations at HHS that would make it easier to discriminate against trans people, despite the Supreme Court decision in Bostock. But you all go for it. You're the panelist. I'm just a moderator.
So I think that there are a number of solutions that policymakers can implement to help protect both trans and autistic people in healthcare. For example, as Victoria mentioned, fighting rules and regulations that would allow providers more leeway to discriminate. Sorry about that. All right. So one method that policymakers could use is making sure that regulations actually protect trans and autistic people. Making sure that HHS or other government agencies put into place rules that ensure that the kind of discrimination that people often couch under religious freedom is not allowed. And there are some pretty good constitutional arguments against this kind of discrimination. Now, note, I am not a constitutional lawyer. I did study public policy, but anybody else can jump in if I'm totally off base here. But so everybody has the right to equal protection under the law, the 14th Amendment. And the Bostock ruling suggests that trans discrimination is a form of sex discrimination. So based on the Constitution and based on the recent Supreme Court ruling, it is or should be illegal for medical providers to discriminate against people based on their gender identity. I also think that it might be wise to pass legislation that explicitly protects trans people. For example, Massachusetts and California and several other states have laws that protect trans people. in public accommodations and in medical settings and in the workplace. And if other states adopted these measures, then it would be much easier to bring a suit against providers that discriminated, or have make it easier to make the formal complaint process. I also think that possibly having an ombuds officer or somebody similar to address these complaints and possibly adjudicate if something goes wrong would be a good idea. Just to have some independent oversight. I think that there's a lot that could be done on the state level, especially if the federal government is being difficult. Especially when we have federal agencies that are run by people with particular ideological dispositions that tend to be hostile toward LGBTQ people in general. As for autistic people, I think that enforcing the ADA and educating people about the ADA is probably the best choice, is probably the best course. Unlike with trans people, the law is much clearer with disability. Though admittedly, the ADA is more difficult to enforce than some other laws because it requires because you have to sue. And there are quite a few steps you have to take before you sue whoever violated your rights as a person with a disability. But emphasizing that it is the law and having more oversight of hospitals who are treating people with disabilities, which they all do, would probably help to mitigate a lot of these problems that autistic folks and trans folks encounter when dealing with the healthcare system.
Thank you. Who else wants to answer that? Just basically, what are policy solutions that can be made?
So this is Kayley, and in 2014, I was part of the National LGBTQ Task Force and a bunch of other groups that were opposing legislation known sometimes as the Murphy Bill, after U.S. Representative Tim Murphy, officially called the Helping Families in Mental Health Crisis Act. And this is an example of bad legislation, bad policy that's couched in, oh, it's helping people. But these are the kind of policies we need to be uniting to fight against. And it was great being part of an LGBT organization that realized the harm this would do to all disabled people, such as increased ability of families, caretakers, and others to involuntarily commit someone to a mental institution, which is another form of prison in my beliefs. And so the other thing was it would have done away with a lot of the kind of privacy protections and disclosed someone's mental illness, possibly also their transgender or LGBT identity, to their family members or caretakers, which is very dangerous in a homophobic, transphobic setting. And these are the kind of policies that it was great to have a coalition to fight against. But we should be fighting for policies. You know, I work with 3 different nonprofit organizations, Values into Action, Alliance for Citizen-Directed Supports, and the National Leadership Consortium on Developmental Disabilities. And all 3 of them have the stated goal of getting people out of these institutions, day programs, congregate care settings, basically settings that isolate often autistic people, but people with intellectual developmental disabilities and other severe mental health disabilities, that put them in these segregated facilities. They have to be away from their friends, their family. It makes it hard for them to make friends. And then they become dependent on a system, an institution that takes away their freedom and their rights, and then says, oh, we're helping them, we're providing them support for their health needs. Well, if they were able to live at home, maybe they'd have friends, maybe they'd have community. Maybe they wouldn't need nurses and caretakers, to meet all their needs. And we should be supporting policies that move people out of institutions and move them towards what's known as person-centered planning and self-directed supports. These can be provided under the home and community-based settings waiver, which can be funded through Medicaid. And these programs let people choose how they want to be supported. They let them hire their staff. They emphasize in person-centered planning that figuring out how you want to be supported is paramount to how you receive care. What are your employment goals? What are your life goals? I've interviewed an artist named Mara Clausen, who runs a very successful art business, gets shown in art shows around the nation, teaches art, and also has been the subject of a award-winning film documentary. And she's able to run her own business and do art because she's able to self-direct her supports and not be in a day program where she'd be beholden to staff that, oh, what's today's activity? Let's all throw you in a van and take you to a bowling alley. Like, she's able to choose her own path. So supporting self-direction, supporting the idea that people should not be locked up in these institutions, that, policies that involuntarily commit people. And furthermore, when we talk about these institutions and people being involuntarily committed, this is also tied into, our government and cultural dependence on police and the regulation of people with mental illness, autism, intellectual and developmental disabilities that are seen as not being full members of society, not being deserving of the same rights as other people, not being seen as being able to make decisions about their own lives. And these are people that, someone can call the cops on, being like, oh, they're having a breakdown, and then that person can be committed against their will, often by caretakers, family members. I just have to say, I find it's extremely ironic that I'm doing this webinar for the National LGBTQ Task Force, because I'm still a little bit bitter that a few years ago at their Creating Change conference, I was violently assaulted by protesters, and I was traumatized by this experience. And this was in 2016. And the next morning, I get waken up early by my roommate, and then all these phone messages and calls. And I was the social media director for the conference. And between the trauma I'd experienced from being assaulted the night before, the being woken up early, these really kind of harassing email or text messages I was getting from my mom, I just had, what you can refer to as a meltdown or a breakdown. I didn't have any spoons. I woke up feeling traumatized, and I got so mad, I threw my phone against the wall. I was the social media director for the conference, and my phone shattered, and now I didn't have a phone, and I started screaming. And the National LGBTQ Task Force decided to send paramedics to my room that then involuntarily committed me to a psych ward that day. So that was not cool. Like, we shouldn't be involuntarily committing people who are traumatized just to traumatize them further, to put them in a psych ward. Literally, they were trying to take my computer laptop cord away from me, which I needed to work, because they thought I was a suicide risk. And I had made the mistake when I was having a panic and the paramedics were like, "Are you going to harm anybody?" And I'm like, "No, I'm not going to harm anybody." And I was so upset that "Are you going to harm yourself?" And I'm like, "I don't know." And they're like, "Okay, you're committed to the psych ward all day long." And I had to fight with psychiatrists all day to get released. It took like 8, 10, 12 hours to get released. So I think police and paramedics, just someone being able to be involuntarily committed, like when all I really needed was someone to talk to me and calm me down and drink some tea and just like curl up back on the bed and just chill. I think this is a form of state violence and a form of violence that we need to stop.
Thank you, Kayley. And I would agree we need to put an end to commit to coercion in mental health care. And in that sense, I am currently writing a piece of research for the Drexel Law Review around coercion and voluntary commitment in mental health care and how it disproportionately impacts marginalized identities. So with that, I encourage people to read it when it comes out next year.
One thing that I think is important to address with policymakers when it comes to changing circumstances for trans and autistic people in healthcare is thinking about really how to change things at a structural level to kind of put decision-making power back in the hands of autistic people in particular. I'm thinking particularly here in terms of like the current structures we have around, for example, guardianship, which kind of puts power over how people are allowed to dress, who they're allowed to date, who is allowed to go where, who has power in a given relationship. When we think about kind of changing that structure and we look at different formats, self-directed supports such as supported decision-making would go a long way in terms of making sure that people who are autistic and people who are trans and autistic in particular would have the power to make decisions about how we present ourselves to the world, but also would really give autistic people the chance to autistic people who under the current system who would be under guardianship, the chance to kind of have control over how we access our supports and who has power over certain aspects of our care. So for example, in terms of a medical setting, someone under guardianship might not have all of the same rights in terms of accessing, for example, hormone replacement therapy if their care provider does not agree with their decision to want to go on hormone replacement therapy. This is just one example of a major medical decision where the power is taken out of that person's hands, but there are a lot more, and that can range from minor things like you need to take medicine all the way up to surgical decisions. And that's a really big deal. And when we look at supported decision-making, where the person in question gets to choose the way that they get their supports and at what point they are able to kind of shift that power and regain it for themselves, that's really important. I would also say when we're talking about autistic and trans people in healthcare, policymakers could do a really good job in terms of promoting non-carceral solutions to accessing healthcare in terms of, promoting non-carceral solutions when it comes to accessing mental health care, particularly in crisis situations. Because very frequently that is used against autistic and trans people in crisis, and very frequently the positions that people are placed in, whether that's involuntary commitment or psych wards, depending on what state you're in, depending on what your health records look like, or if they are listening to you, you might be treated very, very poorly, or be misgendered, or have a variety of micro and macroaggressions put against you as a result of your identities. And that's really, really harmful. So I would say definitely working on promoting self-directed supports like supported decision-making for people who are asking for additional help. I would say promoting home and community-based services. And I would say promoting non-carceral solutions to mental health care are all really important.
Thank you for having us. Thank you for being here. Thank you for your responses. I would love to keep going, but we are eventually going to run out of time. And with that, I'll pass it on to Lydia.
Thank you, Victoria, for your skillful moderation of this panel. And thank you so much to Kayley, Finn, and Noor for each of the things that you have shared. You are all friends of mine and colleagues whom I deeply respect and admire. I have learned a lot from each of you in the time that I have had the opportunity to get to know you. And I am so glad that you are at the forefront of the fights for justice for autistic and other disabled people and for trans people. I know that our movement has a great future because you are part of it. And I am glad to be in the trenches with you and to call you my friends, my comrades, and my colleagues. For those of you that are joining us and learning about this for the first time, we are so glad that you've taken time out of your evening to be with us tonight. We did record this in advance, but by the time that you are watching this, today is in fact my partner's birthday. And I could not be happier that this evening will be spent talking about what trans and autistic people need and will be still advocating for in years to come, because that is work that is at the core of who both of us are. I will direct each of you to the websites of both AWN and the task force, where you can download a copy of Before You Go, and please share that with your friends, with your communities. We hope that this guide will prove useful and helpful for many trans and autistic people out there, and that it will in turn spur further conversation among policymakers, among advocates, and among healthcare providers about what we can do better, so that nobody will ever have to experience the things that Kayley, Noor, and Finn have talked about ever again. And so that healthcare no longer has to be confusing, overwhelming, or traumatizing, but instead be what it is supposed to be: about care, about well-being, about making sure that each of us is still alive to fight another day, and more than that, to be able to experience joy and pleasure, things that we are so often denied, but absolutely deserve. So thank you again to each of you for sharing. Thank you to our interpreters, Victoria and Jaron. Thank you to the task force and to AWN for collaborating to put this booklet out into the world. And thank you to our editorial and captioning team and to all others who make this work possible, and much more to come. Thank you and good night.